Welcome. I'm Dr. Teresa Rispoli with Functional Nutritionist Academy, naturopath, doctor of clinical nutrition, acupuncturist, and functional nutritionist. I'll be discussing how to balance thyroid and endocrine hormones naturally. Do you know that estimated 28 million Americans that have some form of thyroid disease? Unfortunately, most of them don't even know that they have a thyroid disease, up to 60%, and the majority of them are women. Hypothyroidism is one of the most common thyroid disorders. Research suggests that 1 in 10 women over the age of 60 has clinical or subclinical hypothyroidism, characterized by weight gain, constipation, mental sluggishness, depression, dry skin, hair loss, cold intolerance, infertility, irregular menstruation, muscle stiffness, pain, dementia, and a wide variety of other symptoms. Thyroid hormones impact all major systems of the body and are responsible for most basic body functions. They directly act on the GI tract, the brain, the cardiovascular system, red blood cell metabolism, bone metabolism, liver and gallbladder function, lipid and cholesterol metabolism, glucose metabolism, protein metabolism, steroid hormone production, and body temperature regulation. Unfortunately, the number of people suffering from thyroid disorders continues to rise each year. What perplexes me is the fact that thyroid-related illnesses are often misdiagnosed or overlooked because conventional doctors using standard of care only test TSH and T4, missing certain patterns, and fail to do a complete thyroid panel, which would uncover more information, such as the presence of thyroid antibodies, or a need for specific nutrients to correct suboptimal thyroid disorders. They're even put on thyroid medicine unnecessarily, or the person receiving medicine still has symptoms. Or worse yet, if a person has thyroid symptoms, but their lab tests are normal, they'll be told that they're fine. If they insist that they're not, they'll be given antidepressants without further thought. The problem with this conventional medical approach is that thyroid physiology is complex. The key to choosing the best treatment plan is an accurate diagnosis. But if the diagnosis isn't correct, the treatment plan will be ineffective. Makes sense, doesn't it? In functional medicine, we focus on addressing the underlying causes of disease, so patients can get well and stay well without unnecessary surgery or drugs. We have to look at the causes, and there are many. Adrenal stress, lowered immune function, sugar regulation, GI distress, hormone dysregulation, poor intake of or metabolism of micronutrients, and environmental toxic overload with compromised liver detoxification. Then we must verify those determining factors with key functional lab tests, ferreting out key biomarkers to determine the root cause as well as triggers in order to develop a treatment plan that will be effective, with careful attention to symptoms, an accurate diagnosis, and customizing a treatment plan to address the actual cause of thyroid dysfunction. Patients and doctors are getting remarkable results. In this lesson, we're going to tackle the intricacies of thyroid and hormone disorders and identify the root causes and how to tailor the most effective support for each individual patient, thus changing lives for the better. And of course, there's 5 bonuses you're going to receive. 1, learning the 7 hypothyroid patterns. 2, understanding thyroid biomarkers, so lab tests. 3, learning about the adrenal, gut, thyroid connection, very important. 4, how hormone pills, creams, and lotions rob your thyroid health. And lastly, brain chemistry and thyroid function, so psychoneuroendocrine support. Hope to see you in the lesson.